speak your mind even if your voice shakes. We don't even mind to offer explanations in media, even though most of women in a country learn about periods through it. Hello everyone, I am Gaikwadi Nakshi studying in Standard 10, Gajara Vidya Bhavan Sachin, and you are watching our talk show. So today we are going to talk about India's biggest taboo. Yes, that's periods. To better understand this event, we have Dr. Shweta Patel ma'am with us, who is gynecologist. She had owned her IVF Infertility Center, Female First Hospital. She had even conducted many seminars on infertility adolescence educations for girls in schools. She had even done many TV talk shows, radio shows, and being a public speaker in community. She had been awarded with FM Award and Women's Day Award by SMC in year 2020. So, ma'am, it's immense pleasure of us to have you with us. But before that, as we say, felicitation is inspiration to others and motivation to whom we are felicitating. So, in on behalf of our principal sir, my teammates, and Gajara Vidya Bhavan Sachin, I would like to give token of love to you in form of plant.
Thank you so much.
Welcome. So today, we are not only going to be a part of a talk show, but we are going to break a taboo. So before starting our talk show, I would like to request my teammates to introduce themselves.
Good afternoon, ma'am. Myself, Rai Sheetal, student of Gajara Vidya Bhavan, class 10th.
Good afternoon, ma'am. My name is Fozar Saloni, studying in Standard 10 in class 9.
Good afternoon, ma'am. This is Singh Sneha, studying in Standard 12 from Gajara Vidya Bhavan.
Good afternoon, ma'am. This is Ritika Mishra, studying in 12th standard from Gajara Vidya Bhavan, Sachin.
As you see, this issue is pretty controversial. So I am going to open the floor for the questions.
First of all, thank you so much, Mr. Nitin Patil sir, for inviting me here as a guest speaker and giving me chance to share my knowledge with these beautiful girls. And yes, she already said about social stigma regarding menses. So let's we all girls together try to break this taboo in society, and we'll try to share my knowledge with these girls, and hope those who are watching this talk show, it will be helpful to all of them. Once again, I will thank the Global Gajera School trustees and all the managing committees and all the students. Thank you so much.
Welcome, ma'am.
So, ma'am, my first question for you is, how are the causes of irregular menstrual cycle diagnosed in India?
It's very important question in this age particularly. So before giving you answer, I will like to explain about the normal menstrual cycle. I will just share about a few sentences regarding menstrual cycle. Like in menstruation, we are saying cycle. It's not a day, it's a cycle. Cycle will be of 20 days, 30 days, 40 days. So it's a whole interval period. Menstruation means the endometrium, that is the lining of uterine wall, it will shed out during this menstrual phase, and it will be passed along with menstrual fluid, cervical mucus, and will have bleeding from the vagina. So menstrual cycle has four phases. First is menstrual phase, that at the time when we have bleeding. After that, there is a proliferation phase. During this time, endometrium regeneration, that is already started during the menstruation phase. There will be proliferation of endometrium. After that, there is ovulation, which is very much important word for the girls during their pubertal period, during the reproductive career, and during their perimenopausal period also, because it's the ovulation is the time when there is a release of oocyte, and if this oocyte is fertilized by the sperm, there will be embryo formation and the lady will have pregnancy. So this is the terminology which the girls will come across again and again when you will consult with your gynecologist, and when in future you are planning for the pregnancy and everything. So this is the ovulatory phase, and after that there is a luteal phase. In luteal phase, if there is no fertilization of the egg that is released during the ovulation period, so there will be progesterone withdrawal bleeding will occur after the luteal phase is over, and again there will be starting of menstruation bleeding. So these are the four phases of menstrual cycle, like menstruation phase, regenerative phase, ovulation, and yes, if there is no pregnancy, after luteal phase we'll have again bleeding, that is progesterone withdrawal bleeding. Now, what is progesterone and what is estrogen? Two main hormone of our female body is estrogen and progesterone, which is secreted by our ovaries, and it's under the control of pituitary gland of our brain. So there is a pituitary hypothalamo gonadal axis which controls the this menstrual cycle. So now you have asked me the question of irregular menses. So when there is some problem in this cycle, there will be irregularity. And we have seen many cases, even you, one of you may have also felt that once the menarche has arrived or menarche has started, there will be like a girl will get the period at the age of 12, and after 3 months, up to 3 months or 4 months, there will be no next bleeding, and then their mother and girl herself will be in tension. What happened? Why there is no cyclical bleeding? Because in our mindset it is like that there should be bleeding every month. So when there is no bleeding every month, it is called irregular cycle. So what is the normal cycle? Normal cycle length is approximately 24 to 35 days. Some may say it is 21 days to 35 days. So, after 35 days or between 21 to 35 days, you must have one menstrual bleeding. Suppose you don't have bleeding in this period, then we can comment it as an irregular cycle. There are so many reasons of irregular cycle, but most common is hormonal. Hormone either in the form of thyroid disorder, either in the form of polycystic ovarian disease, either in the form of obesity, or there may be some endometrial problem, there may be an ovulatory cycle. In these cases, again, there is a low estrogen and there will be less bleeding and irregular bleeding. So, most of the cases, because of hormonal disturbances in puberty, it is very common to have this irregular bleeding. But what is important here to keep in mind that suppose a girl around the age of 13 she is having period between 2 to 3 months or 3 to 4 months, do we need to worry? No, don't worry, or don't be so much tense. But you people have to keep in mind कि suppose after 3 months you are getting your period, and that period and that menstrual bleeding is lasting for long days, like it's for more than 7 days, more than 8 days, you are passing big clots like structure with the bleeding, yes, then you need to worry and you need to consult your gynecologist, because many a times we have still in our mind that we are getting period after so many days, so let it flow, let it flow. जैसे शरीर में से जो खराबी है वो निकल जाएगी, सो ब्लीडिंग होने दो. इट्स नॉट लाइक दैट, खराबी जैसा कुछ नहीं होता. यू नीड टू टेक सम मेडिकेशन टू स्टॉप इट. So if you are getting irregular period with normal flow, then it's okay. What is the normal flow? Again, a question will arise. What is the normal flow, ma'am? How we can decide it is normal or it is heavy? So again, average menstrual blood flow is approximately 30 to 50 ml. Sometime it is up to 80 ml, but more than it is, we call it heavy menstrual period. We are not measuring it, so we don't know whether there is 80 ml or 100 ml or 50 ml. But according to patient history, like they are passing some clot like structure, they are passing like gush of blood when they are passing urine and stool, or they have more than 4-5 pads changing during the daytime. So from this history we can come to know that she is having more or heavy menstrual bleeding. So see, these are the some terminology. According to that you can decide that we have heavy menstrual bleeding or we have irregular bleeding. So most of the time the reason is again hormonal for irregular bleeding. But when we need to worry, when you are getting too much weight gain, or you have some like a skin problem, like too much acne on your face, there is hair, unwanted hair on face and hands and other parts of the body, when you have a dull aching abdominal pain, or you may have like depression like mood. All these are of hormonal imbalance signs and symptoms. So you can consult your doctor and they will guide you further regarding the treatment.
Thank you, ma'am, for sharing wonderful information with us. May I have a next question, please?
Ma'am, what are the reasons for less bleeding during periods?
When there is a less period or scanty bleeding, we call it oligomenorrhea, or there is one more terminology, that is hypomenorrhea, and one terminology is amenorrhea. Oligo and hypomenorrhea is for scanty bleeding for short duration. Amenorrhea means there is no bleeding. Amenorrhea may be primary or secondary. Reasons are so many, like in case of primary amenorrhea, there may be some structural abnormality, like there is vaginal septum, cervical agenesis, absent uterus, vaginal agenesis, or there may be secondary amenorrhea that may be because of infection, thinning of endometrium, and other like hormonal disturbances. So these are the terminologies: amenorrhea, hypomenorrhea, and oligomenorrhea.
So, ma'am, what are the main causes of infertility?
Yes, it is very important to know about reasons of infertility. Like if I can say about percentage, female infertility is responsible for 40% of cases, and male infertility is responsible for another 40% of cases, and in rest 20% of cases, male and female both are responsible. If you, I will enumerate about the reasons in case of female, most important is infection. In country like India, have you heard the word tuberculosis?
Yeah.
Most of the time when we advise our patient to go for examination of tuberculosis, they will ask us question, I don't have coughing, I don't have fever. Why there is need to examine tuberculosis? Tuberculosis is the organism which can affect any part of our body. So, in case of infertility, when we are talking about the reproductive organs like uterus, fallopian tubes, when there is pelvic inflammatory disease, two main organism is responsible. One is chlamydia and one is tuberculosis. In case of chlamydia, we can give short-term treatment of antibiotic and we can cover it up. But in case of tuberculosis, as we know, we need long-term treatment, like up to 9 months, 12 months. So we do some investigation. What happen if there is an infection of this bacteria in our reproductive organ? They can damage our fallopian tube, means there is blockage of tube. They can damage our endometrium. There is scarring of endometrium. And yes, there is cervicitis. We can hamper the quality of our cervical mucus, which help in transportation of the sperm. So if there is infection of tuberculosis, lady will have chances of infertility. So most common reason is pelvic inflammatory disease, and reason is TB and chlamydia. Other organisms are also there, but these two are main common reason. Second most common reason is age. That I have pointed out in previous question, that age is very much important in case of female. Nowadays, as I have discussed, there is a increased trend of late marriage, delayed childbearing. शादी तो हो गई पर अभी बच्चा नहीं चाहिए. But in case of female, age makes a lot of difference. We have two ovaries in our body. Ovaries have limited number of eggs. When we are born, there is 6-7 millions of eggs in our both ovary. So as you start menstruating, we will have approximately 450 cycles during our lifespan. So when you have one menstruation, there will be thousands of follicles that will undergo atresia. So we can expect there will be 450 ovulation during our lifespan, and this is ovulation is the time where we can have pregnancy. But as the age advances, there will be a decrease in number of eggs in female ovaries, and there will be aging process in our oocytes, like in our eggs. So it can damage our DNA level also in genetic material of our oocytes. So there will be low fertility power. So when there will be increase in age of female, there will be decrease in fertility power of female. So when you are delaying your childbearing, keep in mind you can go for Freezing of eggs also. Nowadays technology is so much advanced that you cannot plan your pregnancy right now because of many reasons. Like suppose you are planning to go, or you are planning to move in out country, you want to settle in your career, there are some agreement that you cannot have pregnancy, or you don't have find proper life partner, so there is delay in marriage also. So in all these cases, you can have your egg freezing at younger age also. So you can have pregnancy with your egg only with the IVF and ICSI technology. This is just for the knowledge of people. It is not that much common, but still many a time we have seen in working class women that they have delayed their pregnancy up to 35. Now they are frustrated. So second most common reason is age. And nowadays, as we know, in every situation there is a one common reason is change in our environment. One is our facing right now corona. So there is because of change in our lifestyle and change in our environment, we have seen that there is decreased quality of egg in both male and female. A reason because of environmental changes. Other reasons, as we know, alcoholism, drugs, and many other. But these three is more common in female. Same thing in male because of this stress, alcoholism, pesticides, environment changes, smoking, alcoholism, increased use of gadgets, and increased use of testicular carcinoma and other problems related to male. So in all are the these all are the reason for the infertility.
Ma'am, what are the treatment availability options for infertility?
Yes, there is we can say infertility is a step by step protocol. There is no one shot treatment for all. First of all, whenever there is couple will have infertility, will take proper history. We do examination like transvaginal sonography of female, and we can know there whether there is any problem in uterus, whether there is any problem in ovary, or we do tube checking of that lady also, and depending on the problem we can advise them for the treatment. And like same thing, we do semen examination of male patient, and we can plan further treatment depending on the sperm count, motility, and morphology. So this basic terminology I am using you to have your idea regarding fertility issues. And according to that, we have like ovulation induction, we can have IUI, we can have IVF and ICSI, and some surrogacy like treatment depend on the cases.
Ma'am, give some information about how to deal with pain and weakness during periods.
Yes, this was very much common question you have asked in last. We call it premenstrual symptoms or premenstrual syndrome. Sometimes these symptoms are so much severe that some girls or ladies will have depression also. We call it PMDD, premenstrual dysmorphic disorder. In that case, we need some antipsychotic drug or counseling also. But if you have simple PMS, yes, we have treatment. First of all is lifestyle changes, do some exercise, take less stress, and take healthy food and proper hydration of your body during this menstrual period. You can have antispasmodic or other painkillers during this menstrual period, but don't take that OTC painkiller without guidance of your gynecologist. Some painkillers are harmful to our body by taking long time. So you may have better prescription by gynecologist. Sometimes some girls also need hormonal pills during this period also. But yes, we can manage these premenstrual symptoms and PMDD also. बट ऐसा नहीं करना है कि भाई घर पे 2-3 दिन छुट्टी ले ली और सोते रहो. ऐसा नहीं करना है. वी हैव ऑल द medicines available to tackle with this, and you can discuss with your gynecologist or your mother or your friends, and you can have further treatment. Infertility means when there is a failure to conceive after 12 months of regular unprotected intercourse. All words used in this definition is very much important. अब सबसे पहला क्वेश्चन ये होगा, ये एज में इनफर्टिलिटी क्यों डिस्कस हो रहे हैं? बिकॉज आप नियर बाय फ्यूचर में जब आफ्टर मैरिज व्हेन you people will planning for pregnancy, now we have seen that because of increased awareness regarding infertility, people are so much aware, like they are scared of infertility. So within 3 to 4 months of planning they will come to us with the frustration and lot of tension in their mind that we are suffering from infertility. So whatever the words that I have used in this definition is very much important. Failure to conceive after the 12 month of regular unprotected intercourse. All this word is very much important because as we know there is change in our lifestyle, career oriented approach, late marriage. Nowadays infertility increased so much. So you are in school days right now. When you will be in college, then you will focus in your career. And sometimes it happens that you may delay your marriage or childbearing. So at that time, in female, there is very much importance of age in consideration to this fertility. So if you people have awareness regarding the importance of age in pregnancy planning, you can keep this point in your mind when you are focusing on your career or when we are delaying your marriage.
Is there an ovarian tumor with hair and teeth?
Yes, we call it dermoid cyst. It can occur in like on skin, in nose, in brain, or when it is in ovary, we call it dermoid cyst of ovary. It contains hair, tooth, sebaceous material, and why this all material in ovarian cyst? Ovary, why ovary contain tooth, hair? Because when there is development of fetus in utero, there will be entrapment of skin element in that part also. So when the girls or like in female, when they advances their age, there will be development of dermoid cyst. Sometime it can be malignant, मतलब कैंसर की भी हो सकती है. So when you are diagnosed to have dermoid cyst, treatment depend on the size of the tumor, characteristic of the tumor. Sometimes it can twist also. So it can cause acute pain in abdomen, like बहुत pain हो गया, vomiting हो गई. So all these are complication of this tumor, and there is no medical treatment available for this dermoid cyst. We have to go for surgery.
Ma'am, what is your experience with a couple when you give them a good news?
We can say it feeling rather than experience, and we cannot describe feeling in words. But we join our hands in front of God. Similarly, like that, infertile couple join their hands in front of us when we give them that you are pregnant and you have very good news. So it is like that for them. We are like God. So feeling of that infertile couple we cannot describe in words. Really, this infertile couple feel so lonely, they feel so depressed, and they feel like they don't have any like motto to live in this life. So it's a very positive feeling, or I cannot describe in word that what I feel when my patient hug me, they touches my feet, or they join their hands in front of me when I give them good news. But yes, I am very happy with my job, that I am doing this job to give happiness to infertile couple.
Not taking much of time. My last question is, what message would you like to convey for girls and generals?
First of all, whenever I am invited as this guest speaker for awareness of this menstrual hygiene or menstrual problem or any other woman related problems, I'm very happy to attend this because like it is like that I didn't get when I was in childhood or school days. So I want to share my knowledge and I want to spread it maximum as I can. Second important thing, for girls, many a time there are many excuses that we are from this family and as a girls we cannot do this, but still, as we are seeing in many social medias or in our societies or in our neighborhood, that girls are doing so many things nowadays which is not impossible for, like gender discrimination के girls ये नहीं कर सकते, girls वो नहीं कर सकते. Yes, we can do everything, but we should have that positive and challenging attitude, so we can have our we can achieve our goal only by that we should be passionate about our goal. Like I want to be like Shweta madam, like I am giving my example, but it's not like that I want to be, but how can I? Yes, you can also. There is nothing new. I have reached here only on the basis of education and my confidence only. because I am from the family where there is no education in my family. They were not so much economically strong to back up me. But yes, it everything is possible if you are positive and you are so much passionate about your goal that you want to achieve. I have running my hospital in that area, which is very much new for me. I am from other area and I am practicing in other area, and I am competing with that my competitors. But yes, I have make my stand, and I advise all the girls, don't give excuse to yourself. Just go ahead and first of all make your goal, and then be passionate about your goal. Then and then you can achieve it.
Thank you, ma'am,
Thank
for
you, ma'am.
answering all our questions. So, girls, perfection is when you accept your imperfections. Well, it's time to wrap our show. But before that, I want to convey my deepest gratitude on behalf of Principal Sir, my teammates, and Gajera Trust to Shweta ma'am, who, with her radiant present, enlightened us all and gave us valuable information.
Thank you so much.
So, audience, have you changed your mindset or not? It's up to you to decide and change. Well, till then, see you next time with new topic and new faces. I am your host Gaikwadi Nakshi. Goodbye.